Hello, guys. We got a very special guest, Lucius, or should I call you Dr. Pomerantz? What's better?
Lucius is fine.
Okay,
Yeah, yeah.
Lucius. And Lucius, not only does he train jujitsu, he's also a bone doctor. So, Lucius, welcome.
Thank you. Thank you for having me. It's an honor.
Yeah, and how long have you been training jujitsu, and how long have you been doing your medical practice?
Okay, so jiu-jitsu, I was lucky. I got an early start. It was actually the late 1990s when I got introduced by a wrestling coach. So I got it. I was an early adopter into the sport, and certainly starts and stops along the way. But it's been 20 plus years that I've been training. And then medicine. I finished medical school in 2008. Uh, and then orthopedic surgery residency happens. I've been in practice for about 7.5 years now.
Wow. So, when you discovered jujitsu and it was a wrestling coach that introduced you to jujitsu, that wrestling coach must have been very ahead of his time.
Yeah, yeah. Garth Taylor, props to him in Santa Cruz, California. Um, a legend of Santa Cruz. And yeah, he got into jiu-jitsu early. He was my wrestling coach. He recommended I try it out. And sure enough, I took a liking to it. But he was one of the first American black belts.
Wow. I'm looking them up right
Yeah.
now. So this is really cool. There's so many legends just in the area. It's amazing.
Oh, yeah. Coastal California. We got an early start. The Brazilians moved out here in the 90s and yeah, so we got a head start on everyone else pretty
Yeah.
much and the
Yeah.
rest is
Exactly.
history.
Wow. Wow. Okay. So I wanted to bring you on today to talk about martial arts injuries, right? It's something
Yeah.
we never want to talk about, but it's something we have to face.
Oh yes,
Yeah.
definitely. It's a thing. No matter how careful you are or how selective you are with your training partners, injuries come up,
Yeah.
especially as you get older.
Exactly. Now, before we go over the list, have you ever had like a significant injury that you had to deal with?
Fortunately, I've been able to avoid surgery, needing surgeries. Certainly have had some nicks and scrapes and been beat up a bit over time, but I've avoided the major catastrophic injury, fortunately.
And I think that's a perfect segue. Let's start with a major catastrophic injury that sometimes martial artists suffer.
Sure, sure. I mean, there are countless. We can certainly focus on the hand,
Yes.
which is my specialty, or we can go all over, however you want to do
Yeah,
it. But
let's do hands. That's perfect.
sure. Well, I guess probably the most common injury to people who are in combat sports or find themselves engaged in combat is the metacarpal fracture. The metacarpal is the bigger bone, the longer bones within the back of the hand, and they're very important. They're the springboard for our fingers to start doing things, the connection to our wrist. Their structure is very important in how they curve. The second and third metacarpals are very fixed in where they are, whereas the thumb metacarpal and the fourth and fifth metacarpals can kind of curve around those second and third ones to make a fist. A lot of biomechanics going on. Classically, the boxer's fracture, it's usually the fifth, sometimes the fourth metacarpal, kind of right towards the head of the bone. Fortunately, doesn't require surgery all that often, but it's by far the most common injury that combat sports athletes have with their hand that I see. And it doesn't necessarily have to happen with punching either. You'll see guys who are in a gi, jujitsu, judo, their hand kind of gets caught in the gi and their fingers twisted, and along with that twisting, bones hate being twisted, the metacarpal goes too. And sometimes they can get by without surgery, but other times, depending on the metacarpal that's broken, those second and third ones are really important to be the strong base to the hand.
Hmm.
And then if it's an unstable fracture, one that where the finger might actually start rotating under the other ones, gets in the way of the fist, gets in the way of function of the hand, that's when a surgeon's got to correct it.
I see. This is super interesting because, again, this is so necessary to explore. But as you can tell by my reaction, this is why most people don't want to talk about it, right? Because,
Yeah, yeah,
I've had a bad finger injury. I've showed you this before, and the nail never grew back. But, as you
yeah.
told me, when you damage the nail bed, sometimes, it's just inevitable. So,
Yeah, yeah, those fingernails are they're a frustrating thing to deal with even as a surgeon.
yeah. Yeah.
But yeah, people don't like talking about injuries. You kind of have to accept that you're mortal and that it can happen to you. And then most of us can empathize when they see it happen to someone else. And
Yeah.
so yeah, talking about it's not fun. But perhaps we could even get into ways of preventing injuries in a little bit.
Yeah,
But
exactly. And before we go into that, which I love that idea, I wanted to get more information on the boxer fracture because you said a lot of
yeah,
times it doesn't need surgery. So tell me more about that. That's really interesting.
yeah. So it being most often the fifth metacarpal, sometimes the fourth, those are the metacarpals that really have a lot of mobility at the joints behind them, further up the arm at the CMC, carpal metacarpal joints. And so the function of our hand, we can tolerate those bones not being perfectly shaped and accommodate to it and changes it. You'll see some people who've punched a lot of things and maybe broke that knuckle. When they make a fist, the knuckle looks different. It's a little depressed, but they've got full function. They can do all the things they want to do. And that's what we can expect. So doing surgery just because the bone's not normal isn't something we need to do. It's all about function. So a lot of the boxer's fractures can get away without surgery, but if it's really bad or the fingers been turned and rotating under the ring finger and they can't make a fist, then you got to straighten it out.
Yeah. One of my friends, shout out Will, he just, so I'm not going to talk too much about this because I think this is going to become a personal injury lawsuit, but
No, no.
he had, it was a tendon that got messed up when he was in a hotel. There was something happened. I don't know the details. I'm not going to speculate, but the tendon got, you could see the tendon. That's how bad he got cut.
Oh no.
Yeah. And so
Yeah.
he couldn't make a fist either. And he's a fighter. So
Yeah. Well, when you start straying into the tendon injuries, tendons are the connection between bone and muscle, and our muscles are the things that move us, and the muscles pull on those tendons, and those tendons pull on the bones. And if the tendon's cut, the muscle can't move the bones anymore, and you can definitely have issues with function with tendon lacerations. So yeah,
but
good luck
for
to
you,
him.
you focus mostly on the bone. You don't do the tendons as much.
No. As a hand surgeon, we get a lot of training in a lot of the other soft tissues. Orthopedic surgery is classically, the bones, and we do like working on bones, the carpentry of that. But as hand surgeons, we deal with tendons a lot, and then there's nerves and blood vessels and all the other little things that go on in the hand that we know how to fix.
Wow.
So tendon surgeries are one of the more common things I do. Yeah.
Do you
And
deal
when
with
people cut
fascia?
them, we try to fix them.
Do you deal with fascia at all?
Well, so if you're referring to like the deep fascia massages or fascial releases and things like that, not necessarily on that level, but muscles are surrounded by a tissue called fascia. And when we're operating in those areas, we're dealing with the fascia. Sometimes there's a very serious issue that can come up called compartment syndrome, where there's so much swelling and the fascia, the tight tissue surrounding it all, doesn't allow for that swelling. And so the excessive swelling can't go out anymore. It starts going in, it starts closing off blood vessels and crushing nerves and can cause some really bad things. And that's when we open the fascia up to get more space for those things to get the blood it needs.
Wow, that's super interesting. Now, when you open the fascia up, does it close by itself, or do you have to go in there and close it after the swelling happens?
Usually we don't. We can let the body kind of heal in and do its thing, because if you close it up too early, then it can come back. And by the time the body's kind of healed and calmed down, you're just trying to get the skin closed and all that kind of stuff. And the body has a tremendous ability to heal. So it's not something you necessarily need to close. That being said, if you're doing a different type of surgery and you're going through fascia, sometimes it's a good idea to get it closed again.
Wow, this is so fascinating. You mentioned the boxer fracture and stuff like that, and that makes me wonder too. A lot of these traditional martial arts styles would say that's why we chop, that's why we throw all these other techniques. But it seems like, maybe you have some muscle here, but when you chop wrong, you probably could break your metatarsal too, right? Metacarpal. Sorry, metacarpal.
Yeah, metatarsals are in the feet, and then carpal is in the hand.
Yeah.
It gets confusing, but yeah, there's a lot of debate on the best way to strike. And some people have even written up papers on how our hand evolved to be a fist to punch. It gets into some nuances of argument, but truly, if you're trying to punch in the strongest fashion, you're actually trying to land on the second or third knuckles. It's the less trained guy who lands the punches on the fourth and fifth knuckles, but also you can be a super trained guy and it's a moving target and things happen, and that's the way it goes. But ideally, you're landing your punches on the second and third metacarpals. But as you know, there's lots of ways of landing a strike, whether it's the classic, karate chop or pluses and minuses to all of it. I mean, some people have argued just trying to land strikes with the palm. Yeah. It's all good. There's all pluses and minuses to it all. But all of them subject you to potential injury. The forces that go through our hand and wrists when we punch can be really high, and there's limits to what our body can withstand. There's wear and tear too. I mean, sometimes you just land enough punches over time and things start to break down. It's not just one moment.
Yeah, exactly. This is really interesting because as we're talking, it's making me think of all the strikes. So you think about the backhand, the back fist versus this type of fist, the hammer fist. And it's like, okay, like for example, the hammer fist, I see a lot of muscle here, right? The cushion, but the back fist, it's mostly bone. So it's like, I got to think about, okay, if I'm landing a back fist, I guess I want to land with this too. I don't want to land with here, right?
Yeah, I think you're trying to land more towards the knuckles, just because it's sharper and it hurts more. Yeah. But again, moving targets and all that kind of stuff, sometimes it's hard to plan exactly how you want to do it, and all of these things can cause injury. And whereas the boxer's fracture, you kind of get this line that goes straight across the bone, and the bone gets mushed in. These other punches, whether it's the hammer fist or other things, you get a different force on the bone and it snaps like a twig maybe. And it changes what, as a surgeon, we have to think about to get the bones lined up right.
I see. Okay, so let's talk about the second injury you see sometimes with martial artists and stuff like that.
So another really common one that maybe people don't need to come to the doctors for, but I get a lot of questions about, is a sprain of the proximal interphalangeal joint. So when we make a fist, the knuckles, that's our metacarpal phalangeal joint. It's the connection between the metacarpals and the first phalange, the metacarpal phalangeal joint. The next knuckle, as we go down the finger, the proximal interphalangeal joint, PIP joint. And the way our fingers are in space and the way we grab things and the way we do things, they are subjected to a lot of forces and often are injured. Sometimes it's just a sprain. Sometimes, though, it gets dislocated and where the joint actually kind of pops out of place. I've seen these injuries actually somewhat frequently with MMA fights. The way the gloves end, the metacarpal phalangeal joints are padded, but then the gloves stop right short of the PIP joint. And then the fingers are independent and free. And so when people are blocking or doing things or grabbing, there's an extra force, a fulcrum that gets put right on the back of that PIP joint, and often it can dislocate. There's pictures out there on the internet of a few fighters. The reason why I wanted to bring up these PIP joint injuries is they stay swollen and painful and stiff for way longer than you would expect. I often tell people just a sprain, just expect there to be soreness and stiffness and pain for 3 to 6 months. A dislocated joint, it's probably gonna be longer. So it's a lot of coaching and telling people like, yes, I get it, you still hurt. Unfortunately, and that's the way these PIP joint injuries go.
Wow. It makes sense because, Lucius, thinking about even when we were kids playing basketball or playing soccer or playing football, right? Sometimes you'll catch the ball wrong. It's going to jam that PIP joint. Now I put a word to it. It's the PIP joint. And it hurts for days, even as a little kid.
Oh yeah. I mean, your fingers are out in space. You're trying to catch that ball. You're trying to grab that jersey, whatever it is. They get twisted a lot. And sometimes there's more severe injuries to it, but even just a little sprain, man, it's frustrating how long it lasts.
And so basically the way they have to deal with it is just kind of, I guess, just deal with it, right? There's no if they come to you, you might prescribe them some medicine. Is that what goes on?
Yeah. I mean, you could talk about things to reduce inflammation and things like that. My go-to, not only to treat the injury but also prevent it, because you do want to keep these things moving as long as it's not still dislocated or unstable. But if it's stable and they can move, okay, you want to keep moving so they don't get super stiff. But buddy taping fingers together, so you got an uninjured finger as the strong splint that keeps the injured finger from getting twisted. So I'm a big fan of buddy taping. And buddy taping would also prevent PIP joint injuries. I'm a big fan of it. It's how I train and do things. I always have my hands protected with buddy taping.
Yeah, that makes a lot of sense. And I guess this will be a place to just shout out Jonathan Kowalski and Graps, because he's the one that introduced us back in the day. So he's
yes,
but it's a compression glove.
Yeah, it's great. It's replaced the tape for me. The gloves are great. I won't roll without them. Slide on. It's great.
Yeah.
Protect my fingers. Lets me be a surgeon and train jiu-jitsu. So
yeah, exactly. Let's talk about the third injury that a lot of people get when they, or not a lot, but you have a high chance of getting.
That you see. Another one. It's got different names. Some people call it a gamekeeper's thumb. Some people call it a skier's thumb. It happens in all sports, but it's an injury to the ligament on the inside of the thumb, closer to the index finger. The thumb has two joints as opposed to other fingers that have three. You got your metacarpal phalangeal joint and the interphalangeal joint of the thumb. It's the ulnar collateral ligament of the thumb metacarpal phalangeal joint that gets torn. And you can imagine if you're trying to grab anything, the thumb gets pulled backwards and kind of off to the side, and that causes that ligament to tear. And the reason why it got called the skier's thumb is people are holding the ski pole and it gets caught when they fall and their thumb gets ripped back. But it can happen in any sport. Anytime you've got your thumb kind of away from your hand. It used to actually happen a lot with boxers back in the day. Our orthopedic hand literature would talk about these injuries, but that was when the thumb was an independent part of the glove. It was its own separate little thing. Since now the new gloves, the thumb's in there, so the thumb's not getting pushed back. But MMA, the thumb is independent. Obviously, jiu-jitsu, judo, sambo, all those things where you're gripping, grabbing, thumbs outside. And so it happens. And the problem is when that ligament is torn, the resistance, the ability to keep the thumb from falling away from the rest of your hand when you pinch or you try to grab something, it's not there anymore. And so you lose a lot of strength. You're unable to do a lot of things because you can't generate that pinch or grip strength. And if it's a really bad tear, then surgery is unfortunately necessary. Fairly common injury that I see.
I see. And so this is a ligament injury. So to remind viewers, ligament is what connects the bones, right?
Correct. Yeah. A ligament is bone-to-bone connection. Yes.
I see.
Exactly. And they support the joints. The joints are where our body moves, and lots of joints in the fingers, but the metacarpal phalangeal joint supported by ligaments, that's that ulnar collateral ligament that gets torn.
So I think, you've dropped a lot of awesome knowledge. My question from an education perspective is, so you went to medical school. Did you then have to specialize after medical school? So it was not just that 4 years or medical school is 3 years or 4 years. 4 years. It's not
4
years.
4 years. Yeah. So it's a long road. So you got your college, of course, you finish college, you go off to medical school. Medical school is, if you go straight through it, 4 years, but there's a lot of programs where people are doing research and things like that. I just kind of did my 4-year thing. And then you go into residency once you finish medical school to whatever specialty that may be within the world of medicine. It could be pediatrics, it could be cardiology, which starts with internal medicine. It could be anything. Orthopedic surgery is the one I did. And that's often a 5-year time period after medical school. My program was 6 because there's a year of research built in. And then after residency, to specialize in hands like I did 1 more year of training in hand surgery. So there was 11 years after college that to get me to the training that I'm at now.
Wow. So that shows, right? That's the difference between just a generalist and a specialist. That's why if you need someone on the hand, you go to Lucius. That's all. You've done a lot.
Yeah, yeah, we definitely, there are a lot of hoops to jump through, and for good reason. If anyone in my family hurts themselves, I want them to see the best. And we fortunately in the United States have amazing medical training and people out there. And if you have the ability to see someone with expertise, do it. The outcomes are going to be better. So yeah, and there's lots of hand surgeons, but I'm one of them.
Yeah, yeah. Let's talk about, do you have like one case that you just remember, whether it took a long operation or something? Do you have one of those stories?
Well, that it's funny because you in the beginning, you're kind of remembering everything. It's all new. And then it kind of starts blurring in when you've kind of seen, I've seen this before, and it's not a surprise. And certainly as a person who takes a lot of call through emergency rooms and trauma, you see some pretty mangled stuff. But I think the story that helps me continue learning and getting better as a surgeon and was just a good life lesson in general. It was probably the last day of my fellowship. So the last day of my training in the subspecialty of hand surgery. And we were going to do a very routine fracture of the wrist. I was with my mentor, and essentially I'm at the point where I can do the case myself, but he's there. That's the way the training works. And he's planning on showing me this cool little trick that he wants to show me with, kind of doing things towards the end of the case. But, we open things up, we're making our approach to the broken bone, and there's a tendon and a muscle that aren't there usually. It's like, whoa, okay, all right. And, we've read the textbooks. I guess this is what people have described as these anomalous muscles or tendons that people have in their body. But my mentor had been in practice for 25, 30 years and had never actually seen it. It had never influenced the way we had done a case before. And so there it was. I was fortunate to see it early in my training, so it wasn't kind of a complete shock when I was out on my own. But it's just kind of a reminder that you haven't seen it all. There's always something new. There's always a way that you're going to have to plan ahead and to get the job done. So it's cases like that really stick with you.
Wow, and that's actually really funny, because I was looking at certain things like that. I was looking at certain muscles or tendons that like some people just don't have, right? A very common one, I think, is like some people have 3 here and some people have 2 or something like that.
Sure. So you're probably referring to, there's flexor tendons that actually move our wrist, and there's a bunch that also flex our fingers. But there's 2 major ones that almost everyone has to the wrist, but there's a third one that goes right up the middle called the palmaris longus. And there's different estimates out there, maybe even as much as 15, 20% of the population out there doesn't have one or both. So as hand surgeons, we always check to see if they have them, because it's a great tendon to use if you need to reconstruct a tendon or a ligament elsewhere in the body, because it's not totally necessary for function. In fact, people can return to very, very, very normal lives without a palmaris. Many people are walking around without them. So we use these tendons, sacrifice those tendons to build other things in the body. And so it's something we check on all the time, the palmaris longus. Yeah.
Wow. Okay. So I think we explored a lot of good stuff. This is more than enough for people to process, and for viewers that want to ask Lucius more questions, we can bring them back in the future. Let's talk a little bit about your jiu-jitsu journey. So where are you now in your jiu-jitsu journey?
So living in San Diego, I train primarily at a place, Victory MMA in Point Loma. Great gym, awesome guys, lots of high-level guys, and a good vibe. I got my black belt, it's been 6 years, 6 years ago. And at the time, Jeff Glover was one of the teachers, but also Dean Lister. And for those of you who don't know, both of those guys, Jeff Glover, Dean Lister, are about as accomplished as you can be in the world of submission grappling and jiu-jitsu, but are as physically different as you can be. Dean was this bigger heavyweight, at least 220 pounds. Jeff is, maybe 140 pounds if he's being generous. very different styles, very different ways of approaching the game, but incredible at what they do. And so I was very fortunate to be able to learn from both of them, along with lots of other guys at the school. And you know, I haven't competed in Brazilian Jiu-Jitsu in a long time, just other priorities, you know. And then I got to be careful with my hands and all that. But while I consider myself a hobbyist, I've been fortunate to be able to do it for a long time, and it's part of my life. It keeps me balanced, gives me exercise and a challenge, and changes things up throughout the day, and it's very valuable. I hope I'm training when I'm 75. So
Yeah, especially because you, being a hand surgeon, you need your hands a lot, right? So I guess this is the
yeah,
perfect segue. Let's talk about preventative things that we can kind of do in general to protect our hands.
sure. So we mentioned briefly just the Graps gloves. Big fan of the buddy taping, and then I found those gloves, and so that's just what I do all the time. Prevention. A big thing also is tap out early. You know, if you're caught, I got to work the next day. I want to pick up my daughter. I gotta do things. I got other things in life, and so it took a while to learn. It took a little while to push the ego out of the way and go, hey, you got me. I'll try to get you next time, but tap out. It's not worth the injuries, especially because I'm wanting to do this for a long time. And then my accommodations also is I rarely put on a gi. The gripping of the cloth is just very unpredictable on the fingers, so that's my compromise. Training in gi is fun. It's awesome. It's a whole other way of doing jujitsu, and then of course it's the way judo is done and sambo. They've got the gi tops, and so I get it. Some people may not want to stop it, but for me, that's something I've kind of let go. I think staying at least somewhat physically fit is really important to prevent injury. If you let yourself get out of shape, or your timing's way off, or you're not flexible, that's when injuries start coming in, especially if you've been out for a little while and you try to jump right back to where you were before. You know, I'm sure you know a lot of people. We all know people who that's how they got hurt. They are out for a little while and they try to go right back to what they were doing before, and that's when the injury snuck up on them. So trying to maintain and stay in shape, keep the range of motion, strength through range of motion, and flexibility are all important. Lots of different ways of doing those things.
I think thing, and I might have asked you this when I first met you, is some people, very old school karate guys or old school kaji kembo guys, they have like a little rock and they're just very lightly tapping the rock with their knuckles constantly for years, and it builds up these really big knuckles, right? And have you ever met or treated or seen anyone that does that kind of like slight gradual conditioning of their hands?
Sure. And there, depending on the martial art, there's philosophies around building up your body to a certain thing. You know, as you were mentioning those karate guys, you know, tapping on the knuckles, you can build up scar tissue, and it makes that area that much more stronger and resilient. Muay Thai fighters, there's all kinds of, you know, kicking down coconut trees and stuff like that, you know, toughing their shins up. And I guess it depends on the martial art and what the priority of the strike is. But yeah, it doesn't hurt to kind of build things up. But as you probably know, it takes years to start getting those changes in your body to happen. It doesn't happen overnight. And to try to rush it is perhaps a recipe for injury too. So slow and steady, building up resistance, putting your body through the things it's going to need to be put through in a controlled way to build strength and resilience for later.
Yeah. It reminds me, I think there's a Jean-Claude Van Damme movie, Kickboxer or something, where his sensei's like, yeah, just kick that tree down. And he like hurts himself, but he kicks the tree down and it conditions him. It's like, that's not the way to do it. Same, like, remember he had that machine and just stretched out his legs? Nope, that's not how you do it. It's gradual.
Yeah. Slow and steady. You know, it's good to have those goals, but no one can just do it first try, you know? Yeah. So yeah, build into it, folks. Build into it.
Yeah. And it almost feels like those movies should come with a disclaimer, like, don't mimic any of this stuff. And I'm sure people have. And it's like, I'm going to do it. I'm going to force myself to split or whatever.
Yeah, no, it definitely the little kids, they watch those things and they're gonna jump off something they shouldn't jump off of or do something they shouldn't. Unfortunately, as kids, you can bounce back from injuries a lot quicker, but what they don't show, and it's even, for the high level snowboarders or skiers or BMX riders who are doing the crazy flips, you don't see the training all that often, but they're doing their big flips into big foam padding to practice, and then they bring it out.
Yeah.
So it's training and practice, and eventually you're ready to bring it out on the big stage.
Yeah, exactly. My last question along this line of prevention and all this is, in capoeira, I'm doing capoeira now, right? You
Nice.
have like this type of stretch for your fingers and your wrist, and you have this type of stretch for your finger and your wrist. So do you have any that you like to do to stretch, whether the fingers or the wrist or the hand? Tell me about that.
Yeah, I guess I personally don't do a lot of static stretching right before an event. Static meaning you put your body into a position and hold it there for 30 seconds, a minute, or whatever. For me, I feel kind of looser, and my muscles don't quite function as quickly as I would want them to function after I've held them into a static position. So a lot of my warm-ups are more dynamic. I go through range of motion, but I'm not holding it. And so whether it's doing some burpees or doing kind of these alligator crawls on the mat or different things, I'm certainly moving my body, putting them through a full range of motion, but more in a dynamic way. And it also warms me up a little faster. It's a little more efficient. But I don't have any secret stretches that I do. I just want to get my body and mind going, ready for the task at hand.
Yeah, and I think this is a perfect follow-up discussion we should have, because I've been looking more into dynamic stretches too, right? Or dynamic movement, because I was long distance running for a while in addition to capoeira. I had to stop that because that's too much strain on the knee to do long distance running and capoeira. So, but the long distance runner would always say, don't do these static stretches before you run. Do the dynamic stuff, get the body moving. Do the static stretches after you run, but don't do it. So this is definitely a conversation I would love to have with you in the future. This would probably be like an hour conversation because we'd have to go into the science, the body mechanics, and everything. So we'll save this for next time.
Love it. Love it. We got plenty to talk about.
Exactly. So Lucius, how do we find you online?
Oh, I guess there's a few ways out there. I got an Instagram handle, Dr._Lucius. My company's got a website, Synergy Orthopedic Specialists in San Diego. I've got a YouTube channel, Cut to the Bone, where I talk about some of these injuries, primarily with a mixed martial arts, jiu-jitsu, combat sports slant. I'm out there.
Cool. Yeah. And so I will have the YouTube channel and probably have your company, and we will, tell people to come to you. So, dude,
Hey.
yeah, it's so funny that when I first met you, we talked about your channel, but I don't know why. Maybe because I'm only subscribed to my chat's channel, but like I haven't seen your stuff recommended to me. So we'll figure out.
The algorithms are failing us.
Yeah, they are, man. It's really annoying. It's really annoying. And it's actually funny. So you did a video on the groin strain, right? So this is potentially another talk for another time. So guys, teasers, lots of great stuff to talk about. I had hip flexor issues due to capoeira that surprisingly weren't a hip flexor weakness, because my hip flexor, my legs in general were very strong. It was the fact that there was something in the kinetic chain that wasn't connecting. So I'll leave that teaser for next time, or the third talk we have.
Yeah, kinetic chains are important.
Yeah, exactly. So everyone, this was Jerry, and we have Lucius, aka Dr. Lucius Pomerantz. He will be back very soon.
I appreciate you having me. Thank you.